أطلعت نائبة ممثلة اليونيسف في لبنان أتي هيغنز صوت بيروت انترناشونال وبيروت سيتي على أبرز الملفات التي تعمل عليها المنظمة الآن وأبرز مخاوفها من أن يعاني 4 مليون لبناني من العطش إضافة إلى التسرب المدرسي والفقر الذي يعاني منه أطفال لبنان.
So UNICEF is working at in a number of sectors in Lebanon. We're working for education, for child protection, for water and sanitation, as well as for health and nutrition. So maybe let me start with the most urgent one at the moment that we're very concerned about is the water situation. We launched a big appeal last month where we highlighted the need for investment in water establishments in Lebanon, where we have 4 million people who are currently at risk of losing access to safe drinking water because of the fuel situation and because the water companies and the water establishments are struggling to buy spare parts, to buy pumps, to buy consumables, to buy chlorine. And if the water system in the country is compromised, it will affect everything else. It will affect the economy, whether we can reopen schools, whether we can open shops, restaurants, workplaces, everything, health facilities, hospitals. So it's very important that UNICEF is supported and that water establishments are supported to continue the safe operating of these pumping stations to have adequate water supply for 4 million people.
Yeah. So through which institution does UNICEF work to ensure that aid reaches its beneficiaries?
UNICEF works through a number of institutions and civil society partners. So we work with the government ministries, for example, as I just mentioned, for the water establishments, we work with the Ministry of Water. For the hospitals, we work through the governmental hospitals, as well as some of the other hospitals. We work with the primary healthcare centres. We also work with schools across the country, with the Ministry of Education, and we are also working with civil society groups, which is very, very important for us, that we work with charities, with non-governmental groups, with community groups, and also importantly with young people in their communities as well, with youth volunteer groups. And also we work with the private sector, with social enterprises. We see a lot of the private sector are doing a lot to support their communities. They're reaching out to young people, they're trying to employ more unemployed people who have no means of surviving with the difficult economic environment. So we also try to work and support the local economy as well through doing as much of our procurement and contracting through the private sector enterprises locally in Lebanon.
Is there a future plan to strengthen social safety nets or support the poorest families amid the increase in poverty rates?
As UNICEF, we're very, very concerned about the high rates of poverty amongst children in the country. All nationalities. Our recent numbers estimate that over 75% of children are now living in poverty, and in many cases this means that they don't even have enough food to eat, so they're going to bed hungry at night. We saw that up to 2/3 of children, their families can no longer support them just for the basic costs of going to school when the schools reopen later this year for the new school year. So it's very important that our interventions are paired with a social safety net. So we are working with the Ministry of Social Development to properly develop a national social protection strategy, and UNICEF has global expertise for doing this, and it's very important that we support Lebanon to have a comprehensive national social protection strategy that is broadly consulted with all of civil society, and we've had over 200 meetings with civil society groups over the last 2 years to discuss the National Social Protection Strategy. And the important part of the strategy is how can it be operationalised. So now we are working with the government to see how we can support with the development of a national disability grant, as well as social assistance child grants. And we're hoping that by November this year, the first one will be launched. In the meantime, because of the emergency in the country and so many children living in poverty, UNICEF has started a new cash program called HADI, where we reach 70,000 children every month with US dollar cash. The amount is $40 per child per month, and the beneficiaries receive it directly from the financial service provider in cash US dollars. And this is to support the families to meet the costs of supporting their children. And so we feel the HADI cash grant is the most important direct way to help communities, rather than doing distribution in kind, which is expensive, and many times it's not appropriate for what the family needs. So it's very important we provide the cash grant as quickly as possible, so that it will help them to meet their most urgent needs. As we move into the government system of the National Social Protection social safety net that should be operationalised together with the World Bank and other partners later this year, but we felt it was important to do something immediately.